Recorded in. Okay, hi everybody. Thank you so much for coming to this session. This is Dr. Rashida Sharma. She is going to talk to us about vocational testing. Just a few minor comments before she starts her presentation. The first thing is, if you have cell phones, please silence them so we can hear the presentation uninterrupted. Please do that. The second one is that I'm going to be providing the conference CEU code at the end. So obviously, please stay throughout. And if you have any questions throughout the session, just obviously bring up your hand, and I'll come to you with the microphone so we can catch the question on the microphone because we're recording. Okay. All right. Very good, Dr. Sharma. Take it away.
Can you guys hear me? Okay, excellent. Then we are live and ready to go. Hello, everyone, and welcome to today's session. I'm Rachida, and I will be here for the next hour and 15 minutes, regaling you with wonderful stories about the history and ethics of testing. Just a little bit about me. I am currently the chair for the Department of Rehabilitation and Health Services at the University of North Texas. Anyone a UNT alum here? No Mean Green people. One, go Mean Green. She's made an excellent choice in her education. I support that. So I've been there now about 9 years. I really enjoy it because I get to do a little bit of everything that I enjoy doing professionally, a little bit of assessment. We've got a clinic, so I get to do some clinical stuff. I get to do administrative stuff. I get to build classes, teach classes. So it's worked out really well. But before that, I used to do a lot of testing. After I finished my master's, I moved to DC, where I worked at the Walter Reed Military Medical Center doing neuropsych testing for a while. When I was doing my master's, I was also at UT Southwestern, so I did some rotations through Parkland Hospital, working in their traumatic brain injury clinic, doing testing. So this is an area of passion that I've had for a long time. And so it's combined very nicely with my other area of passion, which is ethics. I do a lot of ethics related presentations around the nation because I do believe that as professionals, as competent as we want to be in the day-to-day of what we're doing, we also have to keep the ethics in the back of our head as we're doing it. So I have a disclaimer about the presentation. There's a very good chance that you're not going to learn anything new in this presentation. Actually, I hope you don't learn anything new because my assumption is you already know these things. My job is to merely be a reminder of these things. So every time you hear me say something that you kind of remember, you get to pat yourself in the back and say, I remember that. I paid attention in class or when you were reading through the Code of Ethics. But what I hope is that by the end of this, you will really remember a lot of things that govern the practice of testing in whichever area you do the testing right now. So without further ado, let's dive right into it. You've got your session objectives. I'm going to go ahead and we're going to look at identifying the main categories of testing. So we'll do like a quick recap of those so that we're using the same operational definitions for the different types of tests. I'm going to then go into a little bit of story time and talk about the historical context of testing, where things started over 100 years ago and where we are right now. So again, we can all walk through that together. And then we'll kind of cap it all up with looking at various ethical considerations when it comes to testing. And hopefully you'll get to leave with some tips that to keep in the back of your head as you move back after the conference into working directly with your clients. So that's really what we'll be doing. We'll look at the categories, look at the history, ethical codes, and then look at some ethical issues. So when we talk about assessments, and I guess I need to stay in here so everyone can see the slides, right? Okay. So when we talk about the different types of assessments, we're looking at career and vocational assessments, which many of you might be familiar with. We're also talking about personality assessments. So these could be more clinical personality related. They could also be perhaps more focused on what I call the work personality. For example, if you're using the Myers-Briggs, most people are familiar with it, but the Myers-Briggs also has a special form that you can use to look at what a person's personality means in the job search process, the career development process, the interviewing process, and things of that nature. There are also achievement tests. Achievement tests specifically measure what a person knows right now in areas where they've received instruction before. We'll talk about this a little bit more on the next slide. There are also, There are also academic and aptitude tests. And most of you have probably taken at least one or two of these academic or aptitude tests. Some of you might have kids who've taken the STAR test in the past years if you're from Texas. Anyone from Texas here? A couple of you. STAR test, does that make, yeah? Did they change it? Did they call it something else now? Okay. I think it is still STAR. Okay, still the STAR test. Some of you, when you went to grad school, might have taken the GRE, or when you were going into undergrad, you took the SAT, ACT. All of those are going to be your academic or aptitude tests that were measuring your ability to be good at something in the future based on what you know now. There are also intelligence tests that are measuring your ability to learn and apply information, especially in novel areas where you haven't received formalized instruction. Then there are behavioral or developmental tests. So these behavioral tests might either be used for a diagnostic category for behavioral-based disorders such as ADHD or autism perhaps, but they might also look for perhaps intellectual developmental disability, but they might be used in conjunction with some other tests to diagnose specific disorders. And you can also have psychological or mental health tests. So these are more of the back depression inventories, anxiety inventories. You could also do the PCL, which is the PTSD checklist. Also, if you use the DSM-5, there's a DSM-5 cross-cutting symptom checklist. It's a wordy test, but all of these are primarily looking at your psychological evaluation or your mental health evaluation. So when it comes down to career tests, overall, career assessment is a generic term for a process. And this process entails various components that help assist individuals either with clarifying goals or values, or with exploring different career options. It could also be helpful in making informed decisions about the future. So there are various ways or reasons for why career tests come into play. However, what's important to keep in mind is that they may be necessary in really all stages of a person's working life, but especially during times of transition, whether you're working with students with disabilities who are transitioning out of the K through 12 system and into either post-secondary education or gainful employment, or you're looking at a veteran who's come back from or who's retired now and is looking to see what transferable skills they have to move into a civilian occupation. It could be someone who's had new onset of disability and now need to recalibrate their career goals or look at perhaps accommodations that can assist them with doing the job that they were already doing. It could also be a lot of times for moms who haven't worked for many years and now are coming back into the workforce and need opportunities to explore what their current job interests are and how they sync with job opportunities or any skill development that needs to happen to fill the gaps there. So as a whole, there are many different career assessment methods. There are interest inventories. Some of you probably use things like the strong interest inventory, which is essentially a test where there are no right or wrong answers. You just get a chance to understand the person's natural interests that they're drawn to and how those interests match with job occupations out there. So it follows the Holland codes with the REASEC model that some of you might remember back, yes. So looking at professions that are either realistic, investigative, artistic, social, enterprising, or conventional, and then breaking that down further into specific job areas, job codes, actual jobs, and all of the ONET information that breaks down the task analysis of all of these jobs. There might also be values inventories that are part of a career assessment. So these might help you measure work values. What are the values, core values that are important for a person in determining what is a good career fit with them? I do a lot of vocational evaluations for the summer live and learn camps that our department offers for kids with disabilities who are transitioning again out of K through 12 into post-secondary ed or gainful employment. And it's pretty important to ask them, and they're like 17, 16, 18, 19-year-olds, what is an important value for them? Their values are going to look very different in that age than what they might look maybe in 10 years or 20 years. However, it is important to know what their current values are to determine a job fit. If one of their values is that they want to be around friends. They want to be in a friendly environment where they can chit chat with each other. And I place them in maybe a cubicle where there's literally a partition between them and the other person. That might not be the best fit for them based on what's important to them in their job. So values come into play quite significantly in the career assessment process. Personality inventories, as I was mentioning earlier, can also be a very good source of information. We do the MBTI Form M for our students because most of our students are college students, and they really haven't engaged too much in the job search process, the career development process. So this allows us to see how does their personality impact that process. It allows us to identify their strengths as well as challenges that they might encounter, and then troubleshoot it, provide them with some strategies. Many of my students are very reluctant about doing networking. And so we'll talk about, okay, how do you do networking? What is the value of it? What is the process? How do you sell yourself? How do you create an elevator pitch? Things of that nature that, again, assist with that process. There are also lots of career development instruments that help you, again, just tie in information from the other assessments into getting a more holistic understanding of the career development process for the client. There can also be vocational aptitude tests. Many of you might have taken these if you've ever started a job and they say, well, you have to complete this assessment before your start date. They're basically trying to see your particular aptitude at doing well at that job that requires you to do a certain series of tasks. And as I mentioned earlier, all of these are typically combined together for a career assessment, typically. Personality inventories, I believe, sometimes get a bad rap because people often think that they're more clinically oriented. They're more what used to be called, and still are called, more psychopathological in nature. They're trying to identify a specific problem, a mental health problem that a person has. And some of it is true. When we look at MMPI, the Minnesota Multiphasic Personality Inventory, that was the intention of that assessment, to look specifically at psychopathology. What is something that's, quote, off in this person mentally? And so it was almost seen as a way of disqualifying individuals. However, personality tests have evolved a lot over the past several decades. And so many of them, such as the MBTI, like I mentioned, or the 16PF, or even what is the other one I'm thinking of? The Big Five personality one that's been pretty common recently. Those can come in really handy in just getting a better idea of the overall personality, sets of characteristics and behaviors of the person, because that is going to come into play, right? Many of you have probably heard of the phrase that it's easier to place someone in a job. Retaining them in the job is the harder challenge. Right. And that those soft skills that lead to retention are typically part of a person's personality. And so it is important to get a sense of those when you're doing a career assessment. I like this little cartoon that I put in there. So I'm just going to read it out because I was very proud of it. It says, I took a personality test like that once. And the other guy says, yeah, what was your score? And this guy says, none. And so this guy says, no score? And he says, no personality. Right? Well, some people truly are like, there's nothing interesting about me. A personality test isn't going to tell you something, but I've never read a personality test that hasn't told me something about that person. It might just be very common information or very obvious information to them, but obviously they know themselves really well. They lived with themselves all their life, but it's helpful information for me as an evaluator to know in helping them with their career development process. So these personality inventories can be used to measure personality traits or personality types. Personality types are the full spectrum of traits that might make up a diagnosis. So for example, if someone's on the autism spectrum, well, not a good example. For example, if someone has narcissistic personality disorder, well, the type would be narcissistic personality disorder, with telling me that they've met all the criteria. But not everyone is going to meet all the criteria. But if someone does have even one criteria of narcissistic personality disorder, that might be something important to know about them if you're going to place them in a job or help them with their career development process. It also overall helps increase client self-awareness. As I mentioned, I work with students, college students a lot, and so they're still learning about themselves. And the personality inventories typically help them just reflect on their traits, their strengths, some areas that maybe help them better understand why their interactions with certain people go awry. So it can be a very powerful tool for the client as well. Achievement test. I was referring to these earlier. Achievement can be defined as an individual's knowledge or skills in a particular content area that he or she has received instruction. So formalized instruction is what is measured by achievement. Achievement tests are typically comprised of items that require the test taker to demonstrate some level of knowledge or skill. Can you guys think of any common achievement tests that maybe you might have taken at some point? Not everybody at the same time. Okay, her brain has stopped working, so we may have to do some testing on that brain. But really, very basic things. When you were in grade school and your teachers gave you a test, what was a spelling test, right? It's measuring your ability, your achievement in knowing how to spell after your teacher has taught you how to spell, right? Or you take a final exam at the end of the semester. That's looking at achievement as well. Did you learn what you received instruction about throughout the semester, right? Those are all achievement tests. On the other hand, there is, like I said earlier, a difference between achievement, aptitude, and intelligence. Sometimes those terms get overlapped, but there is a distinction between each of them. Achievement, like I said, focuses more on the present, what an individual knows or can do right now in this moment. Aptitude is more future-oriented. So this is why when we're talking about the GRE, the SAT, the STAR test, those are all looking at the person's ability to do well in the future based on what they know right now, predicting what an individual is capable of doing. Little fun fact on the side, the GRE for centuries, not centuries, that's a little exaggeration, for decades has been used as, sometimes I feel very old, it's been used for decades as an indicator of how well a student will do in graduate school. However, the research that's come out about GRE in the past few years is actually saying it's not a very good predictor of that. Someone just said it was, we believed it, and for decades we ran with it. But now when we look at decades and decades of results, it's telling us the correlation that we thought existed between high GRE scores and ability to do well in graduate school isn't quite as high or as correlated as we thought it was. So these things also change, right? We sometimes have to take them with a grain of salt and say, is this really? Let's check the reliability of this. Let's check the validity of this to see if it's really measuring what we think it is measuring. A lot of graduate schools for this reason actually have stopped requiring GRE tests. Yeah, they'll just say, we don't believe that the GRE is an accurate predictor. Yeah, you're like, why didn't they do it 5 years ago when I went to grad school, right? But they do. I know we don't. And a lot of other universities across the country have stopped asking for GRE scores. Then there comes intelligence. Intelligence is a measure of an individual's current cognitive ability, which is their ability to acquire and apply information forward in areas in which they have not always received formalized instructions, right? So if I show you a little test and I say, you've never seen the test before, and I say, this is how you do the test, and then I give you a similar test that follows the same thinking pattern and ask you to do it, I'm looking to see how quickly were you able to learn this new information that I presented to you and then apply it to something similar that comes next. So that's intelligence, a little different from achievement and aptitude. There are many different types of assessment methods. So people sometimes use group tests, sometimes they use individual tests. People will use speed versus power tests. Do you guys remember those terms? No, okay, so a power test is a test that 90% of the individuals whom it is administered to can complete it, okay? So it's more about their ability to complete it. 90% of the people will complete the test. They may not get it all right, but they will complete it. A speed test, on the other hand, is literally measuring how quickly a person can do the task. And while the items themselves will be the same, will be of the same difficulty level, the difficulty level doesn't increase in a speed test. There are just going to be so many items that most people cannot complete them in the time that's given to them. Power tests, on the other hand, typically go up in difficulty level, but there's just enough items that you can finish them in the time given, assuming you're able to apply, logic, going from the easier question to the medium level question to the difficult level question, going up like that. So sometimes speed tests are important because you want to know how quickly can a person do this once they know how to do the task. But other times you want to know more about their ability to build on information that's been presented to them, and then maybe use that to solve some higher level questions or challenges as they're presented to them. There could also be rating scales. So this is very common where you have like a 5-point Likert scale, always agree, always disagree, sometimes disagree, like that. There are also projective assessments. These are more of your Rorschachs and your thematic perception tests, where the person is asked to draw an image or interpret an image, like an ink blot, for example, and then you draw some conclusions from that about their the way that they operate, the way that they approach situations or life. There are also behavioral observations. There could be formal or informal behavioral observations. Sometimes people will, when they're doing testing, make good note of, did the person appear on time? Were they well dressed? Did they engage well? Did they show good effort during their testing? Or did they arrive late and they kind of smelled a little ripe? And maybe we're like on their phone the entire time. We've all been in a room with a person who smelled really ripe, right? And those are tiny rooms. But it's important information, because if you're placing them in a job and they show up to work that way, you know that retaining them in that job is going to be a challenge. So those behavioral observations can be very handy as well and be a part of the comprehensive assessment. There are also interviews, formal or informal. You may have your own checklist that you use. You may use the formal biopsychosocial interview that covers all areas of the person's functioning. There may also be biographical measures, maybe like a written description of that person's functioning that they presented to you, and then you take from that and you draw out relevant information. And then there can be physiological measures as well. So measuring more of their mental health in various ways, whether it's through checklists or asking them questions during the interview based on specific symptoms that you're watching out for to see if there is a concern of mental health challenge in the future. And all of these can be either standardized or non-standardized. Standardized tests, I love talking about, because standardized tests are typically seen as being more formal in nature. All that's saying is they have very highly structured materials that you have to follow uniform administration procedures, and you have to have very consistent scoring and interpretation methods. So an excellent example of this is the WAIS, the Wechsler Adult Intelligence Scale. The WAIS, anyone here use the WAIS as part of their testing? Okay, so with the WAIS, you have a very specific manual that you have to crack open. It's a crackback book, so it kind of stands as you're administering it, and it has written in blue font everything that you must say verbatim to your client. Okay, those instructions have to be read exactly the same way, and then there's specific instructions in parentheses saying, as you're reading this, also do this. So when you're reading and then you're doing something, you're demonstrating something to the client. If you violate the standardization procedures, the test is considered invalid at that point, because all of the scores that you're using for the interpretation of the results, the raw data, are based on standardized testing procedures. So if you use this person's data, but you've changed the way you presented the test, then the scores that you interpret are not going to be accurate. Does that make sense? Yes, okay. Sometimes my students struggle with this part. Standardized tests also have strong psychometrics, just a lot of studies, a lot of research that's done to ensure not just reliability, but also validity. So validity is when your test results are accurate, and reliability is when your test results are consistent. Okay, so what that means is your test measuring what it intends to measure, right? Is it a valid test to use? But you could have a valid test, but is it also reliable? In other words, if you give the same test to somebody 4 times, is there a good chance their scores will be more or less the same, as they should be, unless something, of course, drastic has happened to the individual? Their scores shouldn't vary too much. So ideally, you want a test to be reliable and valid, but you also have to know what is a good reliable cutoff. So typically, if you can get to like a 90% validity and reliability, that's a pretty gosh darn good test. But not every test actually has a 90% reliability and validity. There are lots of tests that are used that just have been used for a while because we're comfortable with them, that may have a lower reliability or a lower validity. Now you might say, well, why would I want to use that test then? Sometimes it's because there are very few tests that are measuring that construct. So you're kind of stuck using a test that maybe is like at 85% validity, but it is one of only 3 tests out there. And that is the one that is normed on the population that you want to use it on, right? Like if, for example, if I want to use the WAIS, which is again, the intelligence test, the WAIS has been normed on over the years on many different populations that include people with different race, ethnicity, gender, disability status. We want that. We want all of these people who represent a microcosm of our society to be part of the norming population so that when we administer the test to one of our clients, there's a good chance there was a representation of them in that norming population. But if we have maybe a test that out of the 3 that are available, only 1 was normed on a wide enough population or normed on a wide enough population, then we may have to use it even if it has lower validity. It is a better fit for our client because of the norming population that was part of it. So sometimes being, or not sometimes, most times being aware of the psychometrics is important, and the standardized tests are going to have better psychometrics because they're being researched every few years. Somebody is researching the validity with specific groups of populations and publishing that data so we can use it. Informal tests, on the other hand, are instruments and strategies that are developed without proven reliability and validity. So it might be a test that maybe you're using because you found that it gives you a good set of information that you need from your client. That's not to say you can't use it. You just have to have a good reason for using it. So it could be that maybe you've constructed your own checklist, and that checklist allows you to ask all of the questions that you typically want to include in your report for the client. Well, nobody's doing research on that particular checklist, but based on the way that you write your reports, that information is covering what you need. And so we can still use that. But of course, you have to remember that it may not be measuring all of the constructs. There may still be some constructs that are missing, or you might just have a perfect test, in which case I suggest doing some research on it so it can become more standardized and have proven psychometric properties that go along with it. Informal tests typically have no standard administration, scoring procedures, or interpretation. An example of this that I often like to give is the Rorschach, right? The ink blot test, all of you are probably familiar with it. The Rorschach is very well known. However, when it was first introduced, it wasn't a standardized test. There was no formal interpretation or scoring procedures for it. So in other words, I could show you a Rorschach card and say, tell me what this looks like. And you could say something, and I could say, oh, definitely got problems, right? But I could give it to Dr. Finn, and she could give the test, and you could give her the same response, and she may say, I agree. No, we disagree. I agree. This actually looks like a bunny. I like the way you think, right? And give that person a high score on it because there was no standardized way of scoring the Rorschach. It wasn't until 20 years after the Rorschach was used that 2 separate researchers came out with a standardized way of scoring it. So you can either use one or the other interpretation method for the Rorschach, and you have to get trained in interpreting it. It is highly complicated. I don't recommend it, but it is fun. Okay. So here's some other examples of formal and informal instruments and strategies. Your formal approaches and interviews are typically going to be structured interviews where you've used a structured form that has specific questions, and you ask every single one of those questions as part of your assessment. When it's informal, it's going to be kind of unstructured. You may have your own interview questions that you like to use, and that's part of your informal procedure. Again, not incorrect, but just different ways of approaching the interviews. When it comes to tests, like we talked about, the formal approaches will include standardized tests and inventories. The informal ones might be perhaps agency tests. You may have developed your own behavioral checklist, or you may have an agency checklist that you want the client to complete as part of every assessment. There may be some work samples perhaps that are coming as part of what the agency requires. So again, those are not going to come with lots and lots of research, but they are relevant in that case because of your agency's requirements or that very nuanced assessment report that you need to write for this client. And then, like I was mentioning earlier, for observations, you could either use rating scales that are measuring the person's behavior based on a Likert scale. You could also record the event. You could, go back and pick from the recording and put down the observations, or it could come from your raw notes or anecdotal records that you have of that person. One time I tested a client, and I think we were like 5 hours into testing, and then she had to do a test on her own. I had to leave her alone for 30 minutes, and I went back and she disappeared, like completely disappeared. I had no idea where she was, disappeared into thin ice, right? Or thin air, not thin ice. I mean, that would be magical if she disappeared into thin ice, right? She disappeared into thin air. And I was talking to my supervisor at that time. I was like, I don't know where she went. And she's like, tell me more about her. Right. And she's like sitting there listening. She didn't have a beard, but sometimes I like to pretend people have a beard when they're thinking. And so I'm explaining to her, and she's like, no, tell me like what she was wearing. And so I'm like, well, I think she was wearing like at least 4 or 5 layers of clothes, and it was like the middle of summer. I should preface with that. She, her eye contact was a little shifty. And she's like, well, does she kind of smell like a smoke? And I was like, yeah, I guess she did. She did have like a smoky odor to her. And so my supervisor was like, well, there's a good chance that she had some schizophrenic traits. And I was like, what? Because I'd never heard that before. But she was telling me, based on her anecdotal experience, having done a lot of neuropsychological and psychological testing over the past 2 decades, a lot of times clients who have schizophrenia will dress in multiple layers, not appropriate for the season or the weather. And they tend to be very closed off, and they tend to be heavy cigarette users. At some point, I'd read a statistic that 70% of people diagnosed with schizophrenia smoke. So it was, again, there's no research study published about it, but that was her anecdotal experience having worked with that population for a while. Are you going to say something about that? Oh, just, okay. That doesn't mean that if you smoke cigarettes, you have schizophrenia. The correlation doesn't work in the opposite direction, okay? Just want to clarify. Okay, so sometimes my students ask me what the purpose of assessment is in the counseling process. So assessment can help with problem orientation or identification, right? Having quantifiable ways of saying, yes, you meet the criteria for this, or do not meet the criteria for this, to help better understand how to map out the treatment for that client. It could also help generate alternatives for how to move forward. It could help with the decision-making process, or it could help with just verification of the effectiveness, evaluating the effectiveness of a particular solution. So I typically encourage all of my students, when they start working with clients, to use brief rating scales or brief mental health screeners like the Beck Depression Inventory, Anxiety Inventory, because if a client scores at a certain level, and then after 6 sessions or 12 sessions, you give them the test again, it allows you to measure in a very quantifiable way if change has occurred. If all the work that the client has been doing in the counseling process has led to a reduction in scores on the same instrument X number of sessions later. So that can be very helpful for clients to also see the change. Or if you think things are going in the opposite direction, where their symptoms are actually increasing or escalating, then you may need to change the way in which you're offering treatment to them. Okay, so I have 3 examples of the value of assessments in case you're still not sold on it. So I'll read them up. A candidate for a position as police officer is administered a personality inventory as part of the selection process. The test indicates that the candidate tends to act before thinking and resist supervision from authority figures. So even though he had excellent training and impressed the interviewers, the candidate does not receive a job offer, right? You can understand why someone who does not respect authority and tends to act before thinking and is going to carry firearms maybe isn't the best fit for that job, right? Based on that assessment. On the other hand, a student who's unsure of what career to pursue takes a vocational interest inventory. The test indicates that she would like the work of a pharmacist. So she signs up for a pre-pharmacy curriculum, but finds the classes to be both difficult and boring. After 3 years, she abandons pharmacy for a major in dance, frustrated that she still faces 3 more years of college to earn a degree. So in this case, the testing went awry, right? She took a test. It said she had a good career or potential as a pharmacist. And she said, all right, if the test is going to say so, then I'm just going to go ahead and do it, only to then later find it wasn't a good fit. So this example is a good one to illustrate that sometimes we have to understand test interpretations are to be used as a guide. It has to be more comprehensive in nature, right? If your test says she would be a good pharmacist, but you've asked questions about what her interests are and, asked a little bit about her scores, like how do you do it in your science classes? If she's failing all of her science classes and I tell her to be a pharmacist because a test told her to be a pharmacist, then that's probably not a very good marriage of the test results and my ability as an evaluator to put them in the context of the information the client has shared with me. So anytime that our students take vocational evaluation and they get a list of careers that might fit them, we always present it as these might be possible matches for you, right? This is not set in stone. This is based entirely on what you've told us you're interested in. But let's also talk about some other things. So we'll match it up with maybe an intelligence test, an achievement test, a behavioral interview, biopsychosocial interview to put it all together. Here's a question.
So, thank you. When I give vocational assessments to individuals, I also try to have them do some type of a practicum, even if it's only a day or two. Good example, one of my neighbors, he's a physician. His daughter always wanted to be a veterinarian. So Dr. Holcomb, who was our vet, I set it up for her to go and work on weekends while she was a senior in high school before she go to college to visit. And she thought you just pet the puppy, give him a little cookie and all that.
Yeah.
But she was experiencing dogs that had been in dog fights. Dogs had been neglected. Dogs been chained up against a tree for a month or two.
Yeah.
She changed her whole curriculum. So assessments are good, like you stated, but I believe in hands-on practical stuff. And but the test shows the direction that the student might want to go.
Right.
But that's one thing I do. I want these kids to touch it, see it, and then they'll make it better.
Yes, absolutely. Thank you for sharing that example. I agree. I actually share my own example a lot of times with my students. When I was a kid growing up, all I wanted to do was become a medical doctor. I wanted to be a psychiatrist. Right. So I went to undergrad, I was pre-med, I majored in biology and psychology. I got into medical school and I was there for a whole week before I realized I hated it. A whole week. And I was like, I can't do this for the next 4 years of medical school, then, 2 years of residency, then a fellowship. And I wish I left. I was like, I'm out of here, med school. And thankfully, my parents were supportive. But then when I came back, I had to kind of reflect and say, what is important to me? If someone had asked me that question about my values, one of my important values that has always been around is work-life balance. And I realized when I got to med school, I was not going to have work-life balance, at least for the next 10 years of my life. And so the moment that clicked, I couldn't be there anymore. And I came back and then worked in a hospital, but not in the medical floor, in the psychiatric floor, and discovered I really enjoyed that part, but I wanted to go the counseling route, not the psychiatry route. And so sometimes just that practical experience can make a very big difference in that area.
Yes. Okay. So I am fairly new to the private sector. And so giving assessments is something that I'm starting. And what better place to ask outside of a room of VR professionals. So here it goes. I have a case study for you guys because I need help. She is in her 60s and she was injured on the job. She was a public transportation driver and she was injured in a car wreck and she's unable to drive again. So she can't go back to that line of work anymore. She is interested in getting back into the field. She has very limited education. She attained her GED, I want to say in her mid-20s, but she has no outside vocational training outside of CDL, which she cannot return to. She has very minimal work experience because I want to say she was misdiagnosed at a younger age. And so she didn't work for 30, 40 years. And so I'm in a place right now where she has to get back to work. She wants to work. I did a career assessment with her and literally I did the rating scale and everything was either dislike or strongly dislike. I am very interested to see what those results are. Hopefully they're in my mailbox when I get back. But I am at a loss here. So if anyone wants to chime in on what to do as far as do I continue with assessments with her? I do know doing an intelligence test or an academic or a
Achievement.
achievement test, yes,
Mhm.
will probably not be beneficial just due to her limited education. Because that's just going to highlight, that she doesn't have the academia side. And so I'm kind of at a loss here. So if anybody wants to help me out, I will give you my business card.
Okay, well, it looks like there's somebody who's got some ideas for you. And then I've got one too after that.
I just was going to say that I think it kind of goes back to what this gentleman said about giving people exposure. In my experience, people that score dislike or a low interest on the interest inventories, oftentimes it is due to that lack of exposure. And so really looking at situational assessments, how we term them, putting people on the job in little trial sessions to see how they do, for me, has been the best assessment. It takes a lot of hustle, I think, and a lot of work to find that opportunities for people. But I think that when you're looking at maybe low cognitive functioning and lack of exposure, that's a nice way to get a good idea of what could be possible.
Yeah.
Factor that I left out. That one important thing. She lives in a very rural town that has
That's it.
the area is horrendous. They're like mom pop shops. It's kind of like who you know and small town vibes. So, and the nearest town to her that has like a more metropolitan feel is probably a good 50, 60 miles away from her.
Wow.
So the commute is horrible for her injury. So that adds another flame to the fire.
It does add another, you're right. Flame to the fire, is that what you said? Okay, I like it. I'm gonna roll with it. And we got another idea, and then I want to say something and we'll move along.
When I've had test scores like that with clients, they tend to be very angry, very depressed, and typically see themselves as being totally disabled. And that fits with what you just added.
Right. Yes, absolutely. Thank you for bringing that up. And that actually leads into what I was going to say. The beauty of being a vocational rehab counselor is being able to bring in the counseling side of things when you're working with your clients, right? So when I'm looking at or working with a client like this, absolutely, like you said, I want to see what their own their self-efficacy, what do they feel about their abilities? I'd want to ask them some questions about that. I typically will ask my clients like their own miracle question, and I'll say, if you could wake up one day and you were doing the thing you love to do, what would that thing be? It doesn't even have to be a job. It could just be a thing, right? And she might say something like, well, I guess I would just like get up and then I'd go and someone would tell me what to do and then I would do it and I would come home. That's still giving me a little bit about the fact that this person needs a little bit of structure, a little bit of guidance. They don't want a job where they're fully autonomous, where they're just told, they need someone to guide them along. So then that allows me to look at perhaps some specific options for them and then present it to them. With your client living in a rural area where job opportunities are limited, that also impacts a person, right? Like, how do you believe you can do something when you just don't even have more than 5 options of what you can do? And so sometimes just walking through that, talking about, like I said, the values, what's important to them in their job, and saying, okay, if you want a job and you're not sure which one, let's try this one out. Try a day, do an apprenticeship here for a week or something like that. And then see if you like it. If you don't like it, we can talk about what you didn't like. So we can look at another option that might have less of the things you don't like and more of the things that you like. So it is a process. Yes, you had something to say? Okay. These are all great. Thank you for your input.
Along the lines of what she's saying, I often would ask them, jokingly they think, but what is it you wanted to do when you were young? What did you want to become? Because you take them out of the state of where they're at and they can go back into that moment. And then I share, well, if they don't take it seriously, kind of chuckle, well, I don't know. And then I say, well, this is what I wanted to be. I wanted to be a professional baseball player, but things happen in life and they do. And that kind of opens up, but you put them into that state and then they may be opening. And well, I often remember I used to think I wanted to do this and do this. Oh, and it goes off of what she's indicating. Now you have something to go off of.
Right.
And then the bushes. Go out and meet employers. You got to do that. That's the best way of doing it, making personal contact with the businesses.
Great, thank you. And the one last thing I'd say is also the assessment that you select might perhaps not be the best fit for her. So if you suspect there's a reading or learning disability, maybe, because did she take the test herself? Like she had to answer the questions or you asked her the questions? Mm-hmm. Okay. Mm-hmm. Yeah. Okay, sure. Yeah. Okay. Yeah, sometimes with my clients that maybe have a lower, IQ, or I suspect might have a reading disability, I'll give them a test that has pictures, such as a pictorial interest inventory. So they're not looking at or thinking of an abstract concept of what a server does. There's a picture of, someone lifting plates from a table. So they can look at it and be more aware of what exactly that job is. Because when I work with younger kids, I call them kids, but like teenagers, they may not even know what that job actually is. So to think about it abstractly is a little harder for them. Okay. Uh-huh. Yeah. Okay. Well, I'm happy to chat with you about this after the presentations. Okay, you have one quick thing to ask. Okay. I was just going to lean into you, but that's.
I was just going to say real quickly is that one of the things that I find, and I don't know if this is the case at all, when I've done the interest inventories, is a lot of the times I have to remind them that that's not an abilities inventory, it's the interest. So do you think you might like it? Not whether or not you can do this. And so I have to repeat that, especially I repeat that when I just keep getting a negative response all down the row.
Yeah, that's a great point. Thank you, Dr. Finn. Absolutely. And I always tell my kids or my clients that you may not have done it before. That's okay. Do you think you might like it? Because sometimes they're answering not interested because they think they will not do a good job at it. And so that's where like, no, I don't even want to do it because I've never done it before. But that's not how interest inventories work. It's based on, do you think you might enjoy doing this in the future? Okay, so you guys are like hitting the nail on the head about my next point, which is that most tests are pretty awesome. However, test results are not always very useful. It's all about how you interpret them. So concerns arise when test results are either misused or improperly used based on a client's reading level or cognitive level, so that we don't get the right results or the appropriate results for that particular client. These might also occur when you're testing individuals from minority groups, because maybe the test that you're using wasn't actually normed on that minority population. Like the MMPI, the Minnesota Multiphasic Personality Inventory, it was normed back in the 50s? Back in the 50s, yes, on 5,000 Minnesota farmers. How much in common do any of us have with Minnesota farmers? Okay, so she may have a lot in common with Minnesota farmers, right? But I grew up in India and then I moved to the US and I've lived in Texas for 20 years. I have very little in common with Minnesota farmers, I think. So that test back then might not have been a very good test to be used for me. It might have actually said that I had some serious psychological mental health problems because my tests were being ranked next to people who had a very different life experience because of their race, gender, ethnicity, and status in life and things like that. So you definitely want to be mindful of that. You also want to ensure you're not using tests to label or stereotype a person, or you're not using the results to stereotype a person and their abilities. So for example, I work with a group on campus called Elevar that is for students with intellectual developmental disabilities. Okay, they get a chance to come to campus, they live on campus, they take classes with other students. So this cohort has 15 students and I do a group with them. And let me tell you, although all of them have the label of intellectual developmental disability, IDD, each of them has very different cognitive abilities. Some of them, I can tell I have to really break down my words and use the simplest words I can. Some of them, they're using words that my college students use, right? Even though they have the same diagnosis, their actual abilities are very different. And so it's important that just because a test result indicates a certain diagnostic criteria, we're not making assumptions about that person's ability. At best, we use it as a guide to then further evaluate those areas. Like one of these students that I work with has extremely high emotional intelligence. She's so in sync with other people's emotions. And then I have another who you could like poke him with emotions all day long and he would have no idea what that word is or what that emotion is, because he has very low EQ. And so in terms of their job placement, one of them does very well being a greeter at an event center where, you know, she wants to say hello to everybody and connect with them, while the other does really well being behind like the ticket window and just like cutting out the tickets and handing them to people. He doesn't want to talk to anyone. He's not going to chit chat. Also, when you're engaging in high stakes testing for school or work, then sometimes those results are used inappropriately. For example, if your young kid has to have a certain cutoff for the risk, which is the Wechsler scale for children. What if, you know, they're coming from a family where they've been given a lot of coaching on that? So of course they're going to test higher on it and have a higher chance of being accepted into this charter school or magnet school than a kid who perhaps has not had that opportunity. So you kind of have to keep a lot of context in mind when interpreting test results. I like this other cartoon that I have here, right? This guy saying you will be evaluated by how well you handle this testing. And she's to drive a car with like square wheels. So obviously she ain't going nowhere. But you can see the frustration on her face where you're asking her to do something and it's not possible. She's giving it her best effort. And, you know, the evaluator is just like, she didn't move. So that's her fault. You know, she didn't make it work. Instead of thinking, was this a good test? Was this test constructed appropriately so that it could actually measure what it needed to measure? The validity, was that there? So now here we come to story time. I promised you that earlier, so we're going to dive right into it. Also, I realize I talk really fast, so feel free to stop me at any time. I can use that time to breathe. Okay, so here's a summary of early landmarks. Okay, testing began all the way back in 2200 BC when China began the civil services examination, way back when. But in the more modern times, we're really looking closer to 1862, where Wundt used a calibrated pendulum to measure the speed of thought. So he literally asked you a question, the pendulum, and right, he's measuring how long it takes you to come up with an answer for that. Went back to story time. Wundt also thought that testing was something that was genetic, like intelligent people gave birth to intelligent people, which, I mean, certainly there could be some correlation there, but we also know that that isn't always a linear case that he thought that it was. Francis Galton in the 1884 administered the first test battery in London. When I talk about a test battery, I basically mean a series of tests, not just one test to say, okay, I gave you a test. It's putting together a battery of tests that complement each other to give you the information in a more comprehensive manner. In 1890, Cattell used the term mental test. That was the first time that test was used in the history of the world. And he announced his agenda for his use of Galtonian test battery. I'll talk about that in just a second. Now we moved on to the early 1900s, where we had Clark Whistler, who used brass instrument tests that have he discovered that these tests that were used by Cattell actually had no correlation with college grades. So it took about 11 years of college students getting tested with brass instruments, only to then find out that actually there is no correlation. Kind of like the GRE, right? Like imagine a surprise, and then the students are going, oh, okay, well, then that's 10 years of my career gone down the drain. A very modern first intelligence test came up in 1905 with Binet and Simon, who put it together. But it wasn't until 1914, 9 years later, that the actual term IQ or intelligence quotient came to being used. Then we have Lewis Terman, who developed the Binet-Simon scale that were normed on an American population. Or I forgot to say, the Binet-Simon was normed on French population, so different from the Lewis Terman Simon Binet scales. Then we had the starting of group testing. So Robert Yerkes from 1917, he spearheaded the development of the Army Alpha and Army Beta tests for doing group testing during World War I. Anyone taking the Army Alpha, Army Beta tests? Someone was telling me that they're still used, but of course not this version from 100 years ago. but more of an updated version that sometimes is still used to just figure out transferable skills that a person is coming in with into the military. Then we had our first personality test developed in 1917. Rorschach came around just about 102 years ago in 1920. And that was when it had no accompanying interpretation. It was literally just ink blots, and you just hold them up. I would interpret them the way I wanted to. Someone else might interpret them the way they wanted to. There was very little inter-rater reliability in what the actual ink blot was supposed to mean and what a person's response to it indicated. Then we have PsyCor, which many of you might be familiar with, Psychological Corporation. That's where we get a lot of our tests these days. They were launched in 1921, about 101 years ago. Then in 1927 was the very first version of our favorite strong vocational interest inventory that was published. So this test is also 100 years old, but of course has been normed with more comprehensive, more diverse populations to make it a much better test now than what it was 100 years ago. And then we had the Wechsler-Bellevue Intelligence Scale published in 1939. And this one was different from these because the Binet-Simon and the Binet-Simon scales actually focused only on one quotient of intelligence. So that's why the term intelligence quotient actually didn't even come around at that point. They were just looking at verbal IQ as we know now. They didn't know that now, but back then it was more about verbal skills. So are you able to provide a verbal response? And we know now that sometimes people might struggle with verbal responses, but that doesn't mean that they don't have the intelligence to answer that question. We saw this a lot when I did testing for individuals with traumatic brain injuries. Sometimes they just had aphasia where they just couldn't retrieve the word to give you the answer, but for tests that were nonverbal, they actually did very well on those because they had the ability to do it, they just didn't have the ability to verbalize that response at that time. So the Rorschach was the first intelligence test that actually measured multiple types of intelligence, so to speak. So it was more comprehensive in that way. And then in 1942, we had the MMPI that came around. And then we had the Wechsler Intelligence Scale for Children, the WISC, that was published in 1949. So I'm going to go a little faster than ever to quickly go through the rest of our history of assessment and testing. So psych testing in its modern form, like I said, came about 100 years ago. Francis Galton was the guy responsible for that. However, before you admire him a lot, let me also say Galton also devised techniques for measuring beauty, personality, and the boringness of lectures. Okay, so I'll take it with a grain of salt. He was, interestingly enough, also the half cousin of Charles Darwin. So, you know, possibly was inspired by him. Half cousin. I don't know how they were related, but yes, yes, we can talk about that later. I don't exactly know how half cousins work, but maybe first cousin was a better term for it. Okay. Next, we have Cattell, who studied with Galton and then proclaimed the modern testing agenda. He actually wrote a whole paper titled Mental Tests and Measurements. He coined the term mental test. And I kind of like this guy because here's what he said. He said that psychology cannot attain the certainty and exactness of the physical sciences unless it relies on a foundation of experiment and measurement. Because before that, people were kind of making things up as they went along, okay? He said a step in this direction could be made by applying a series of mental tests and measurements to a large number of individuals. So not just focusing on one person, but really bringing in the norming concept, right? You have to test lots of people before you draw conclusions from it, because it could be that the one person that you selected for a test was an anomaly in how they performed on it. He said these results would be of considerable scientific value in discovering the constancy of mental processes, their interdependence, and their variation under different circumstances. He also said people will find this interesting and it may be helpful as they make decisions about their life moving forward. So I thought this guy was onto something back in 1890. Next, we had Alfred Binet, who came in. He was a French public school minister is what he was. And he was commissioned by the French government to assess children with intellectual disabilities at that time. So he introduced the Binet-Simon scale in collaboration with his colleague, Theodore Simon, thank you, I can't read apparently. Theodore Simon back at the Sorbonne. So they kind of put their heads together on this one. And then Then we had Henry Goddard. So you're starting to get impressed, but don't get too impressed, because Goddard came around and horribly misused the scale that was built for French school children. He uses to classify people as idiots, imbeciles, and feeble-minded. Okay, so a little harsh there, guy. But he thought he was, intellectually superior and had found a way to categorize people into all of these categories that were basically labeling them or mislabeling them. But then it gets better or worse, depending on how you see it, because Goddard was actually invited to Ellis Island. Remember Ellis Island? Yes. So he was invited to come to Ellis Island in 1910 to assess intelligence among immigrants. Okay, based on what I've said so far, you probably know where this is going. So Goddard very nicely or unnicely, through his assessment, concluded that the rate of feeble-mindedness was much higher among immigrant population. He said 83% of the Jewish immigrants, 80% of Hungarians, 79% of Italians, 87% of Russians were all feeble-minded people coming in. Okay, but here's the thing: the test in what language? Exactly. How many of these immigrants coming in do you think were speaking English fluently enough to take a test in the language? Yes, yes. So we're not really surprised now that these people were getting classified as being feeble-minded when they were being given a test in a language that they didn't speak, and that also was a norm on them and their cultural background. He also gets better, I tell you, made the case that feeble-mindedness was a threat to society and uses that as justification for low IQ immigrants being deported. Okay, yes. So, that's how it goes. However, again, we have a hero who saves us. Howard Knox comes in and he says, all right, this isn't working, Goddard. So he debunked some of his conclusions and actually highlighted that tests needed to be modified, intelligence tests do, so they fit the parameters of the person being tested. So now we have Lewis Terman. They developed the Binet-Simon scale at Stanford University. So that's why it was called the Stanford-Binet scale. And this was one of the first tests that was looking at a more comprehensive concept of intelligence than just that verbal intelligence. They were also measuring fluid reasoning, knowledge, quantitative reasoning, visual spatial processing, like how quickly you can see things and make sense of them, and working memory. They measured verbal and nonverbal responses. And then we had the guy I really like, Romanian-American psychologist, Wechsler, who developed the single score. He objected to the single score that was offered by the Binet, and developed the WACE, which is currently used in its 5th iteration. It has been retested and renormed every 10, 15-ish years since it was developed. And then he also, a couple of years later, developed the version to be used in children. Here's an example of the Army Alpha test that Robert Yerkes developed. The Army Alpha measured verbal ability, numerical ability, and the ability to follow directions and knowledge of information. The Army Beta was actually developed, it was a nonverbal component. So it was developed to evaluate, at that point, illiterate or non-English speaking recruits. So they were starting to understand you can't test somebody in a language that they don't know. You have to have either a test in their language or a different way of testing that. And this is still true. So while the RISC is considered the gold standard in intelligence testing, the Raven's progressive matrices is a nonverbal intelligence test that you could give to anybody in the world, and you can measure their intelligence without speaking their language or them speaking your language. I've used it with individuals with cognitive impairments, and it allows me to better understand what their ability is, even though on a traditional IQ test, they might score much lower because they just have problems with understanding abstract concepts that are not visually presented to them. Okay. Oh yeah, so we hadn't learned enough from the way tests go awry. So then comes Brigham, who undertook a massive analysis of alpha and beta scores for these specific populations, Nordic, Mediterranean, and Alpine, and he concluded that these populations were intellectually inferior. He said that there's a dire warning that racial intermixture would inevitably cause deterioration of American intelligence. Of course, thankfully, 7 years later, he said, oops, my bad, that wasn't right, and ate his words. Okay, so I'm going to quickly go into our ethical codes because we have 10 minutes left. I've been talking a lot. So actually, I'm going to skip through this. It is interesting, right? This is why I actually teach a whole semester long course on assessment, because there's so much to talk about. But let me bring you guys to the CRC Code of Ethics. Many of you are CRC certified rehab counselors here. So I pulled from their ethical code. Section G on assessment and evaluation is all about what you need to know to be an ethical evaluator. I'm going to read out the bloat for section G because I think it's really informative. They say rehab counselors use a comprehensive assessment process, we talked about that, as an integral component of providing individualized rehab services for their clients. While assessment is also associated with the administration of tests, it is actually a broader process that goes beyond gathering quantitative data like scores on things, but actually entails a collection of qualitative data as well. So these are behavioral observations, these interviews, you taking the time to get to know the client. The terms assessment and evaluation may be used interchangeably. Evaluation is often referred to as a more specific process intended to assess an individual within the context of his or her living, learning, or working environments. And rehab counselors promote the well-being of clients by developing and using assessment and evaluation methods that take into account the client's personal and cultural context. And we try to prevent the misuse of instruments. So all of that is what we've been talking about so far, right? That's really the big paragraph that tells us what our ethical responsibilities here are. But this gets broken down into various components of the testing process. So when it comes to informed consent, you want to ensure that you're telling your client what the test is about. You also want to ensure that if you're not supposed to tell them what the test is about, then you don't do that. For example, the WAIS, which is the intelligence test I've talked about a lot, has very standardized instructions in which you cannot use the word intelligence to introduce it to your test or to your client. Because the reasoning is that if somebody tells you they're measuring your intelligence, how are you going to feel about that? Anxious, right? And so they don't want people to be like super anxious. Oh no, they're going to think, my students think this a lot. They're going to think I'm dumb, or you're going to kick me out of grad school. And I'm like, no, we're not doing that. You're already in grad school. But people sometimes tend to underperform when they're super anxious. And so you have to make sure you're following the right parameters for informed consent. You also want to ensure that the release of assessment or evaluation information is undertaken in an ethical manner. You're not supposed to release raw data to your client or really to anyone. And testing results should only be released with the consent of your client. And they have to also understand whether the release of that data might harm them in some way. If so, you have to have a conversation. I mean, you're testing them. You need to give that report to somebody. That's why you're testing them, right? But your client also has to know what it is going to be used for. That's important. I used to do a lot of testing for clients coming in from Texas Workforce Commission, and they would show up and I'd be like, you ready? And they're like, I guess my voc rehab counselor just told me to show up, so I'm here. They had no idea what they were supposed to do, what the expectation were. They just showed up where they were told to show up. And so we had to make sure we were telling them, well, you have to put in good effort. This is going to tell us a little bit about your skills, your abilities, any challenges that you may have. Because if they think, oh, it's no big deal, and they're on their phone or they're looking out the window on a timed test, they're probably going to score lower, not because they don't have the skills, but because they just didn't put in that attention or that effort into it. You also want to ensure that you're engaging in proper diagnosis of mental health disorders if you're diagnosing them at all. Now, I'm actually going to get to this part very quick. I have little sections on each of these, so let me just go there. We talked about informed consent. We talked about release of assessment information. So this is where we are, proper diagnosis of mental health disorders. So I like that the CRC code specifically says that rehab counselors must carefully consider both the positive and negative implications of a diagnosis. Oftentimes I run into people, evaluators, who are reluctant about diagnosing, only because they're reluctant about diagnosing because of their own comfort with it, without realizing that sometimes that diagnosis or lack thereof can actually hurt or help the client. And so you want to think more about the client as opposed to yourself. If you feel you're not trained in it, then get the training so that you feel more confident in diagnosing it, but also don't diagnose it if you're not confident with diagnosing it, if that makes sense. Cultural sensitivity, the historical social prejudices. When it comes to competence to use and interpret test instruments, you want to be aware of the limits of competence. use tests appropriately, make decisions based on the results, but also put them in the context, a larger context of the client, and ensure that you're using tests that are providing accurate information. You're using appropriate tests, looking at their validity, reliability. You're also looking at the referral information. If you're getting your client referred over from elsewhere, make sure that they're giving you a set of questions that you can address. A lot of times people use the same battery over and over and over again with all clients that come in. That's actually considered unethical because the battery should be designed to answer the questions that need to be answered for which the client has been referred over for. They may be the same battery, but it shouldn't just be a knee-jerk, this is the test battery that we use at all times. You also want to use instruments that are culturally diverse. You want to make sure you're aware of the testing conditions. If you're using computerized testing, well, you have to make sure your client knows how to use a computer well enough, right? Especially if it's a timed test. You can't make the assumption they know it. One time I was testing a client and I gave him an iPad, and then I realized I don't think they know how to use an iPad very well. And so we had to say, I'm like, actually, you know what, let's use a computer instead. And, you know, I had to turn on like the actual desktop, and they were very comfortable with that, but the iPad wouldn't have been a good one for them because they would have struggled more with using the device as opposed to completing the test. You also want to avoid unsupervised administration if you're working with interns or other individuals who are learning the process. You want to be aware of interpretation errors, psychometric limitations if your test, is it reliable, is it valid? When you're reporting scores, you must ensure you're reporting standardized scores, not raw scores. Okay, so that means whatever the cumulative score is, you don't just present it as it is, you convert it into the language of standardized scores so that, you know, for example, on a race, someone could test 73 on one of the subtests. 73, it could mean anything, but when I say they score 110 as a standardized score, that's a different language I'm speaking because anyone can then pull up the standard curve score and see, okay, 110 falls in this category, but 73, the raw score, could fall anywhere based on their age norms on that test. You want to also interpret test results or instrument results to the clients in a way that they understand them well. And lastly, you want to ensure that you keep the test security on your mind. We don't release tests as a whole. We ensure if my clients ask for a copy of the test, I'll usually sit down and explain to them in order to ensure that this test is able to do what it needs to do for everyone. We have to ensure not everybody gets to see a copy of the actual test, but I can share with you the results of it. And so I'll explain to them what the results mean for them. And I've never had someone who's then said, well, no, I insist that you give me the original. Because once they understand why they can't have it, then they're okay with it. You also want to ensure you're not using obsolete tests or instruments because a lot of them are providing outdated tests. Typically, when the newer norm tests come, you should switch to the newer tests within a year of them being launched. When the WAIS 5 was rolled around, many people were still using the WAIS 4 about 3 years later because they're expensive tests. The whole kit costs about $1,500. And so people who had bought the WAIS 4 were like, we'll just try using it as much as we can. But at some point then, those test results from the 4 are obsolete if the 5 has been 3 years in use. If you're constructing tests, you want to make sure that you're being ethical about it, using current scientific procedures for it, norming it on diverse populations, and then also replicating the results as much as possible. Okay, am I done? 1 minute. I have 1 minute. I'll talk very, very quickly. Okay, so 3 sources dictate if counselors are competent to use tests: test publishers, professional associations, and states. Some people argue as long as you're trained in doing it, you should be able to do it. We've talked about a lot of the client welfare issues, so I'll skip over this slide. You want to be aware, we talked about technology issues, use the counseling process as we were talking about with your case study, address test anxiety, because if they're too anxious or too little anxious, if that makes sense, it may impact their effort on the test, and be aware of coaching results as well. So this is like a quick cheat sheet. I put this on the handout that you have. Be aware of standardization requirements, sources of anxiety, the testing environment, expectancy effect. Are you only seeing what you think you want to see? Are you engaging in a stereotype effect where you're trying to confirm your negative bias by giving them a particular test? or our clients internalizing things. Like if they're coming from a group, a minority group that is thought to underperform in a specific thing, and you give them a test on that thing, there's a good chance they won't put in effort thinking they're going to underperform on it. Okay, so that is all I have for you all. If you have questions, you're welcome to send me an email. Thank you for your time.